We're just about a week out from when the Texas Maternal Mortality Committee will begin reviewing new cases of women who died giving birth or shortly thereafter. Thanks so much for joining us. I'm Jennifer Sanders. The committee chair, though, recently announced their members would be skipping over full reviews of deaths in the years directly after federal abortion laws were overturned. KXAN's Jayla Washington shares the committee's reasoning and why it's raising some concerns.
Things that we're doing to be more contemporary.
In this September 27th meeting,
to be more efficient in our work.
This announcement from the chair of the Texas Maternal Mortality Committee that they'll be skipping a full review of death cases from 2022 and 2023. That means deaths that may have resulted from delays in case caused by those abortion laws won't be looked at by them.
This is not the first time that we have, if I like to call it, leapfrogged forward. If we were still reviewing year after, we would probably be at about 2016 now.
It's a move.
Let's look at the times that women go in and they say that they're hurting.
Maternal health advocate Nakenya Wilson, who served on this committee for years, is worried about.
I'm hoping y'all have my back.
As she says she herself almost died giving birth.
We owe it to those women and their families to understand what happened. And we owe it to the women of Texas who have less reproductive freedom in 2024.
The Texas Department of Health and Human Services says though the Texas Maternal Mortality Committee won't be doing a comprehensive view of cases from the past 2 years, DSHS will still analyze and publish data. In fact, it says some data from 2022 has already been added to dashboards and that more will be added. But Wilson does not feel like that's enough.
If we're concerned about being able to move through the cases efficiently, then the resolution is not to skip cases. The resolution is to optimize the process.
Jayla Washington, KXAN News.
Wilson, who, as Jayla just mentioned, served on that committee for years, says part of what makes the process of reviewing death cases longer is that Texas requires some patient information be redacted before it gets to the committee. The chair of the committee mentioned in last month's meeting they'd like to see the state get rid of that requirement. The chair is also pushing for her committee to be allowed to review abortion-related death cases, which they found out earlier this year included in data they review. Going in depth now, federal public health data shows that the number of women in Texas who died while pregnant, during labor, or soon after childbirth skyrocketed following the state's 2021 ban on abortion care. Between 2019 and 2022, the rate of maternal mortality cases in Texas rose by 56%, as opposed to a national 7% increase over the same years. That's all according to an analysis by the Gender Equity Policy Institute. That's a nonprofit that scoured through records from the CDC to put the data together. Meanwhile, last week, Georgia's public health commissioner disbanded a state committee that looked into pregnancy-related maternal deaths. It came after someone released information on 2 deaths, which ProPublica reported the committee decided were preventable, but found doctors were hesitant to perform a procedure to save their lives because of the state's strict abortion policies. The commissioner said in a letter that whoever shared the information violated state law and a confidential agreement signed by committee members.